What do you think are some of the common misconceptions of the CNS role, if any?
I think I hear and I feel a lot CNSs are educators, right? Mm-hmm. I think a lot of institutions hire CNSs to run their educational backbone for the health system, and there's a lot of good reasons for that. I think a lot of people have had experience with the CNS provider in previous settings where they are the educator of the unit or the group.
Yeah.
And so you kind of know exactly who an educator is, what they do, and, what skills day looks like or whatever. There's a cadence and a yearly thing that kind of feels like the same. And you get boxed into that pretty readily, at least on the surface.
Yeah.
I think that's kind of one of the more consistent ones I see for us. I think the other ones are clinical nurse specialists or just an advanced bedside practitioner. And so I see, and I feel like there's a lot of folks who would say that, oh, that's a nurse who can take, 7 acute care patients instead of just 4, right? Because they're just that good, right? And in some ways, maybe, but I think anyone who's been around a while can take a little bit more load, but you just kind of feel like an Uber nurse as opposed to an advanced practice licensed independent practitioner, right?
Yeah.
And so it's, those things like that. And we still fall in the same tropes that nurses have in general, right? That you're some sort of hierarchical position that you and the physician have, that the physician runs the show and the nurse is there to follow orders, right? And in a nutshell, that's functionally what it may look like, but really it's a cohesive, symbiotic group that needs each other to work, right? Like the physician has a lot of time to look at a cellular level sort of thing, come up with the best guess, but the nurse has to do the experiment, right? Has to work with the patient and align the care and do the teaching and also be vigilant to what's working, what's not working, and bring everybody together, right? The glue that holds everything together. And
there's a quote. I gotta remember this quote. It's from Donna Deers. It just made me think of this. It's a really good quote pertaining to nursing and, like why nurses want to be nurses and not something like a higher in the hierarchy. It said, it's from Donna Deers. It said, nursing is about having an indifference to power for power's own sake. It's a pleasure associated with helping others from the position of a peer rather than an assumed superordinate. And I thought that was that just made me think of that quote that, it's very much, it is, you want to deliver care on the same, level as patients or peers instead of, talking down to people. And
exactly right. It's this equilateral triangle, right? Like everyone is participating. And I think I've probably shared with you this a time or two. There's a spectrum that healthcare personnel has to meet the patient 100% of the way all the time, right? And the patient's job is simply to be receptive to that plan. And half the time our job is just to coax the patient along the way to, change their lifestyle, to, maybe not use the substance so much, or maybe just to adhere to a regimen because that's our only way to get good data to see if it's working or not, right?
Yeah.
But there's a balance that once that connection starts to happen is, how do I ebb and flow with the real life of things, right? When it got me kind of thinking a little bit earlier about this, I see you kind of transition. I control a lot of things in that world, right? I'm your heart, I'm your lungs, I'm, creating blood pressure for you where it doesn't exist. And I'm thinking about how all the cells jive. But at some point, those amalgamation of chemicals need to stand up and walk and do it themselves. And so that's, I find my acute care colleagues, and I'm starting to get pretty good at it too, can realize it and see it, and just it's messy sometimes, right?
Yeah.
And the way we coordinate that is a very powerful thing. And I think being a member of that coordination is one of the more humbling aspects of the job. Right. As an advanced practice nurse, as a CNS, I'm no more or less important than anyone in the care team. Right. And my job is just like the bedside nurse in a lot of ways, is to be the glue to bring resource to the situation.
Yeah.
To see if we can maximize what everyone's mutually trying to get out of it and what's meaningful.